Chairman, and thank you for calling this hearing. I truly thank our witnesses today for their knowledge and for their willingness to be here to share with us their information. In about 2 weeks, our nation will mark the 4th anniversary of the enactment of the Affordable Care Act, better known to most as Obamacare. Today's hearing will inform what direction we will next take health care in America by examining access to care and cost associated with health care systems overseas. As we examine single-payer systems in other countries and what we can learn from their experiences, it seems fitting that we also take stock of where things stand in the American health care system today. At the time Obamacare was being debated in this very committee, I warned that it was the wrong direction for our country. Healthcare was broken before Obamacare, but 4 years later, the American people are experiencing firsthand how the new law has made things worse. That's why Americans view the law unfavorably, and that's why they are understandably wary of still more government involvement in health care. The President promised that if you like your plan, you get to keep it under Obamacare. The federal government mandates that Americans buy health care coverage, and not just any coverage, but the coverage the federal government says is good enough. Sadly, millions of Americans have lost their health care plans, health plans they liked and wanted to keep, despite the promises and continued delays of the administration. Obamacare expanded Medicaid, an unsustainable health entitlement program in which 40% of physicians on average do not even agree to see Medicaid patients. I believe the experiences of other countries will reinforce what many Medicaid patients already know. Their coverage does not always translate into timely access to care. Today's hearing will also examine cost. While the President promised that Obamacare would bring down premiums by $2,500, premiums have actually gone up by an average of 41% in the individual market due to the law's mandates. So, how does Obamacare attempt to control cost? For starters, it established the Independent Payment Advisory Board, or IPAB, an unelected, unaccountable board of 15 bureaucrats empowered to make cuts to the Medicare program, most likely in the form of cuts to doctors, which will impact, again, seniors' access to care. Today's hearing will be informative as to the direction we take health care in this country. Will we repeal Obamacare and replace it with reforms that lower health care costs, put our nation's entitlement programs on a sustainable path, and empower patients in their health care purchasing and decision-making to find the plans that best meet their individual needs? Or will we continue on the current course of unprecedented government involvement in health care and unsustainable costs? What do we have to learn from a single-payer system overseas, and what have other countries' reforms meant for their patients? What would such a course mean for our nation standing as a global leader in medical innovation, and for American patients seeking access to quality and affordable coverage and care that meets their individual health care needs? I do want to thank Chairman Sanders for holding this hearing, because it will inform many of us on these important questions. I think today's hearing represents an important admission that Obamacare is not working. That such an admission takes place within the very committee that the act was written in is a huge step, and I commend the committee for taking it. I look forward to hearing from our witnesses today and continuing to work with my colleagues to advance patient-centered reforms that will actually lower health care costs and increase access to quality, affordable health care. I thank the chair.